everyone. Thank you for joining us for this second webinar in our educational series. My name is Nicole Helfrich. I'm a certified coder who has been with Titan Health since 2007, and today we're going to talk about mechanical ventilation. In the world of COVID, mechanical ventilator use is at an all-time high, and today we're going to briefly discuss what it is and how to make sure your facility claims are being coded properly to maximize your facility reimbursement. What is mechanical ventilation? It's a type of treatment that helps a patient breathe when they're having difficulty or cannot breathe on their own. Sometimes it's used during surgery. Mechanical ventilation can be invasive or non-invasive, with invasive involving a tube being inserted into the patient's airway and non-invasive methods being used at home by people with various respiratory issues. There are several different types of ventilation. There's negative pressure ventilation, positive pressure ventilation, mechanical methods, and hand-controlled methods. The type of ventilation assists you in proper ICD-10 PCS code selection, which is a key component to your DRG selection. Consecutive use of the ventilator in hours is one key aspect in ICD-10 PCS code selection. It is easy for hours to be miscalculated because of the renewal of physician orders and several start and stop times that must be evaluated. Because there are several different ICD-10 PCS codes that can be selected, the proper calculation of those hours that drive the PCS code will also have a significant impact on the DRG that is selected. Here you can see a sample mechanical ventilation PCS code range. The code starts as 5A19, but then you see the hours begin to determine the code selection as the code expands. Looking at the second code on the screen with 5A1935Z, that is for consecutive hours less than 24. You look at the next code, 5A1945Z, that is for 24 to 96 consecutive hours, with consecutive being key. With 5A1955Z, that's the highest coded category with greater than 96 hours. This code can be the determining factor on whether you get a higher weighted DRG or a lesser weighted DRG. Moving on, using 5A1935Z as an example, you can check the crosswalk to see which DRGs are supported by the ICD-10 PCS code. Here you can see that DRG 208 comes up. This is respiratory system diagnosis with ventilator support less than or equal to 96 hours. Looking at this PCS code, 5A1945Z, this still gets you to DRG 208, but look at the next slide. Here you can see ICD-10 PCS code 5A1955Z. This is a PCS code that represents greater than 96 consecutive hours. Look at what it does to your DRG selection. Not only does it open it up to more options, you see them all include ventilator support greater than 96 hours. Maybe you're asking yourself, Nicole, why does this matter? My DRG says that a ventilator was used. Well, let's take a look at the next slide. Here we get into the impact on reimbursement. This is a screenshot of Medicare's Table 5, list of MSDRGs with their relative weights. As most of you know, your relative weight plays a major role in both your Medicare and commercial reimbursement. Commercial, provided your contract terms are DRG-based and not per diem based. Here you can see the two DRGs we've been reviewing. DRG 207. This is the one for vent hours greater than 96 hours. Your relative weight is 5.7485. But look at 208. That is for anything less than 96 hours, and your relative weight drops considerably, down to 2.4829. That's over 50% less. And to put this into perspective for you, let's assume you have a commercial payer who pays base times weight, and the base is $10,000. DRG 208 would pay $24,829. And remember, that's for less than 96 consecutive hours. But that same visit, if it was billed with DRG 207, would pay $57,485. That's a difference of $32,656 from just one digit that could be off in your PCS code. Hopefully, this demonstrates to you just why the attention to detail and the audit of these PCS codes is so important to your hospital's reimbursement. Specific to the relative weight of the DRG, Here you will see a quote from the Office of Inspector General. The weight reflects the average level of resources for an average Medicare patient in the DRG relative to the average level of resources for Medicare patients. The weights are intended to account for cost variations between different types of treatments. More costly conditions are assigned higher DRG weights. To summarize what we've discussed today, proper selection of those ICD-10 PCS codes representing ventilator use is key to proper reimbursement. Once you've confirmed your patient received mechanical ventilation, remember this. The PCS code selection is determined based on the number of consecutive hours, impacting the 5th digit of the 7-digit code. Thorough review of your ventilator orders and start and stop times will help lead you to proper code selection. And with proper code selection, you ensure your facility is receiving the most appropriate reimbursement per your contract. On behalf of Titan Health, thank you for your time today. Please feel free to reach out to me with any questions you may have, or if Titan Health can be of any revenue integrity solutions for your facility. If you like content like this, please make sure to subscribe on our website, and you can also follow us on social media where we regularly share informational content like this. Have a great rest of your day, and I hope to see you next time.